Hi guys, I'm Nurlana Zari Mama Hashim,
Hi, my name is Nurul Farnatasha binti Muhammad Samsi.
and today we are going to do a presentation about ovulation. Before we dive in, let's talk about the learning outcomes. First, understand the process of ovulation and its significance in the reproductive cycle. Second, identify the normal anatomy and physiology related to ovulation. Third, recognize the pathophysiology when the ovulation does not occur properly. And lastly, learn about the signs and symptoms of ovulation disorders, including their impact on motility and morbidity. So, what is ovulation? Ovulation is a key part of menstrual cycle where a mature egg is released from one of the ovaries, typically around day 14 of 28-day cycle. During ovulation, women going through three phases, which is first follicular phase, second ovulatory phase, and lastly luteal phase. Fun fact, did you know that some women can actually feel when they ovulate? It refers to a mild twinge or cramp on one side of their lower abdomen. This occurs around the time when the ovary release an egg. Not all women experience this, but for those who do, it can serve as a neutral indicator of their most fertile period.
I will talk about the female reproductive organs. Firstly, we have ovary, produce eggs, and female sex hormones like estrogen and progesterone. Next is we have oviduct, the fallopian tube, passageway for eggs from the ovaries to the uterus and provides the site for fertilization by the sperm. Then we have uterus, where a fertilized eggs implants and growth into a fetus during pregnancy. Next, we have cervix, allows menstrual blood to flow from the uterus and serves as a pathway for sperm to enter the uterus. Last but not least, we have vagina, receives the penis during the sexual reproduction, allows the menstrual blood to exit the body and lets the baby passes through during childbirth. Next, I will talk about the stages of the menstrual cycle. Day 1 until day 5, we have menstruation. Lining of the uterus is shed, resulting in the release of blood and tissue from the body through the vagina. Then, day 6 until day 14, follicular phase, when the pituitary gland releases hormones that stimulate the growth and development of ovarian follicles. Then, day 15 until day 19, ovulation phase, when a mature egg is released from the ovary and is ready for potential fertilization. Last one is day 20 until day 28, the luteal phase. Empty ovarian follicle becomes the corpus luteum, producing hormones that prepare the uterus for possible embryo implantation.
As we can see in the picture, as estrogen level rise during its menstrual cycle, especially during the follicular phase, it can stimulate the hypothalamus, which release gonadotropin releasing hormone or GnRH to prompt the pituitary gland. Responding to the calls, pituitary gland secretes follicle stimulating hormone which stimulates the growth of ovarian follicle. As this follicle matures, they produce estrogen to thicken the uterine lining and signaling the pituitary to prepare for the next phase. Around day 14, a surge of luteinizing hormone occurs triggered by peak estrogen levels, leading to the release of a matured egg from the dominant follicle.
Next, the path of egg maturation and release. Prior to eruption from the ovary, an egg first must grow and mature. Until stimulated to grow, the primary egg cell passes through a period of dormancy that may last several years. The egg cell is surrounded by a capsule of cells known as the follicle. The follicular wall serves as a protective casing around the egg and also provides a suitable environment for egg development. As the follicle ripens, the cell wall thickens and a fluid is secreted to surround the egg. The follicle migrates from within the ovary's deeper tissue to the outer wall. Once the follicle reaches the surface of the ovary, the follicular wall thins. Pressure caused by the follicle and fluid against the ovary surface causes bulging of the ovarian wall. When the follicle ruptures, the egg and fluid are released along with some torn patches of tissue. The cells, fluid, and egg are directed into the nearby fallopian tube. which serves as a passageway by which the egg reaches the uterus and as a site for fertilization of the released egg by sperm. One of the disorders of ovulation is the Polycystic Ovary Syndrome or PCOS. PCOS is a disorder where the ovaries generate excessive androgens, male hormones found in small levels in women. Polycystic ovary syndrome is the term used to describe the multiple small cysts that develop in the ovaries. There are women with the disorder who do not possess cysts, and there are women without the disorder who do develop cysts.
So what makes it different from a normal ovaries? First, hormonal. PCOS is a hormonal imbalance that occurs when your ovaries create excess hormone. If you have PCOS, your ovaries produce unusually high levels of androgen hormones. Second, structure. Ovaries may be normal in PCOS, and conversely, polycystic ovarian morphology may be seen in women without syndrome. However, it is well accepted that women with PCOS tend to have larger ovaries with an increased number of follicles. Let's talk about the signs and symptoms. Signs of PCOS are abnormal hair growth, darkening of the skin, cysts, skin tags, and thinning hair. For the symptoms of PCOS are irregular period, acne, obesity, and infertility.
I will talk about the morbidity and mortality of this disorder. Firstly is the morbidity and cardiovascular disease. The individuals with PCOS have an increased risk of hypertension, abnormal cholesterol levels, and atherosclerosis. Next is type 2 diabetes. High prevalence of insulin resistance among those with PCOS leads to significant risk of developing type 2 diabetes. Next is obesity. Many people with PCOS struggle to maintain a healthy weight, which further exacerbates insulin resistance. Next is endometrial cancer. Chronic anovulation associated with PCOS leads to unopposed estrogen exposure, increasing the risk of endometrial hyperplasia and cancer. Next is mental health issues. There are higher rates of anxiety, depression, and eating disorder of individuals with PCOS. Sleep apnea. The risk of sleep apnea is increased due to obesity and hormonal imbalance. Last one is infertility. Irregular ovulation leads to difficulties in conceiving, making PCOS the most common cause of infertility in people assigned female at birth. Next is mortality, cardiovascular disease. The risk of heart attack and stroke is higher, which is leading causes of death in individuals with PCOS. Then type 2 diabetes, complications from poorly managed diabetes such as cardiovascular disease can contribute to increased mortality. Next is cancer. There is an increased risk of endometrial cancer which can be fatal if not diagnosed and treated early.
Finally, we have reached the end of our presentation. So, let's recap what have we done. First, we have explored ovulation critical roles in menstrual cycle, normal anatomy and physiology. Second, we have discussed a common ovulation disorder which is Polycystic Ovary Syndrome or PCOS. Third, we have explored the characteristic of PCOS by excessive androgen hormone disrupting ovulation, causing multiple ovarian cysts. Lastly, how this condition impact reproductive health, leading to irregular periods and infertility.